Hi Laura, I'm Megan.
Hi.
I'm going to be your student nurse working with Greg Lutz. I was hoping you could give me a report on him.
Okay. We have Greg Lutz. He's a 67-year-old male in room 621. He's a full code under the care of Dr. Phillips. He is no known drug allergies and has an order to be up as tolerated. He was diagnosed with diabetes 20 years ago, and usually his blood glucose is in the 120s, but for the last 5 days they've been up in the 300s. He comes to us for the hyperglycemia, for the high blood glucose for the last 5 days, and he also has a non-healing wound on his right heel that he noticed 3 weeks ago that is increasingly getting worse. He tried soaking it in salt water at home, and it was no relief. He had a hemoglobin A1C done about 3 months ago that came back at 5.2%, and he denies any headache, admits to tingling in his bilateral lower extremities, and it's worsened over the last 3 months. He denies any change in thought content or behavior, denies depression or anxiety. He denies cough and dyspnea, wheeze, or chest tightness. His lungs were cleared of auscultation and has a history of his mother passing away at the age of 78 from lung cancer. He denies any chest pain or palpitations, no edema or shortness of breath, no syncope. Father died from an MI at the age of 53. Pulses were good. He followed an 1800 diabetic diet, but has since decreased his adherence to that over the last 9 months and is requesting some information about that. He denies any changes in bowel habits or constipation or diarrhea, and no nausea or vomiting. At 1550, he had 320 milliliters of urine that he voided. 5 years ago, he had a transurethral prostate resection and denies flank pain or dysuria, no urethral discharge, no sexual dysfunction, and no pain in the testes or the scrotum. His last CVG was 242, and last vital signs at 1645 was a pulse of 76, O2 stat of 96, and a blood pressure of 128/70. He does have a IV site in his right forearm that was put in on Tuesday, and he is receiving today his two different types of insulin, a regular and a a regular and NPH that he is going to get. Is there any questions you have before we go in?
I do. Can you tell me why the client is receiving the medication?
He's receiving the medication because he is type 2 diabetic.
And what does the insulin do on the body?
The insulin promotes the uptake of cellular glucose, and it also promotes storage of glucose as glycogen. Basically acts as a key to allow the glucose to go into the cell and come out of the bloodstream.
When should you question administering the medication?
You should question administering it when they have any signs of hypoglycemia, cold and clammy, anxious, tachycardic.
Does the medication have a therapeutic serum level?
No, it does not. We go by the sliding scale on this one.
Okay. And what vital signs should be monitored?
You should monitor their blood glucose level and also their pulse to make sure they're not tachycardic.
What interventions should be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
You want to make sure that the client is storing the medication properly, knows to change sites so that they don't get lipohypertrophy, wears a med bracelet, conforms to a diabetic diet.
Okay. What are the side effects and potential adverse reactions?
Would be hypoglycemia and the lipohypertrophy.
And how will you know the medication is effective?
You You know the medication is effective when the blood glucose level drops to within normal ranges.
Okay, I don't have any other questions.
Okay, well, I'm about to go administer these medications. Would you like to come along?
Yes, please.
All right. Hello, Mr. Lutz. My name is Laura. I'm going to be your nurse today. I have a student nurse with me, Megan. Is it okay if she comes in with us?
Oh, yes.
All right, I'm going to wash my hands. How are you feeling today?
Fine.
Great. All right, let's see here. And can you tell me your name and date of birth?
Greg Woods, and I'm 67.
Awesome. And do you have any allergies to medicine?
No.
No? Okay. So we're here today because we're going to be giving you 2 types of insulin. One is a fast-acting one that needs to be taken along with meals. Have you eaten recently?
Yes.
Yes? Okay. And the other one is your long-acting one that you get twice a day.
Okay.
Okay. I'm going to check in my book here. Well, before I do that, let's pull you up. Alright, so you're going to be getting your NPH and regular insulin. Are you familiar with taking these medications?
Yes.
Okay. Alright, and it looks like they were given last to you at 1700 and you're due at 2100, which is now. And we got Greg Lutz, 67 years old. Greg Lutz, 67 years old. I'm going to put this number in. And the first medication is your NPH, which is your the long-acting one, and it expires January 2018, so we're good. And I've already called and confirmed with the pharmacist that this is the correct dose and route of medication. And so we've confirmed that it's the right time, 2100, the right route subcutaneously, the amount, and the route. The medication. You have the NPH and the regular, and we have Greg Lutz here. So the NPH, you're going to be getting 20 units of that. And let's see. Where was the last place that you received your
Right
injection?
here.
Okay, so the top. So we're going to put it in the lower right abdomen, if that's okay with you.
Yep.
We want to change injection sites so that we don't cause any scarring or scar tissue to form, okay?
Okay.
So we're going to administer 20 units of your NPH into the lower right abdomen because of a glucose level of 242.
Mm-hmm.
And then I'm going to initial here that I gave you this medication. And we have the regular insulin, so I just need your band one more time.
For me?
And I've also checked the expiration, June of 2019, so we're good on this one as well. And this medication also given at 2100, and This one we're going to give 16 units because that's on a sliding scale. It bases it off of your last blood glucose in the doctor's orders. Anywhere from 181, oh, I'm sorry, anywhere from 241 to 300, you get 16 units. So you're at 242, and we're going to give 16 units. And I'm also going to initial that I gave this medication to you. And I've compared the medications to the doctor's order. And I've also compared it to the MAR. So I've already washed my hands. Gloves on. I'm going to take an alcohol wipe and I'm going to wipe off both vials, clear it of any contaminants. And I'm going to go from my NPH first. So I'm giving 20 units of my NPH and 16 units of my regular insulin. So that's a total of 36 units. So I'm going to draw back 36 units of air. And we're going to put air into the NPH vial first. And the NPH is getting 20 units. So I'm injecting 20 units of air. And I'm going to put the remaining 16 units into the regular insulin. And then I'm going to pull back 16 units of the regular insulin. Would you like to verify that 16 units? Yep. Then we're going to go into the NPH and draw back to 20. Giving me a total of 36 units. Okay. So again, I'm going to double check. I have Greg Lutz here, 67 years old, and he's receiving NPH and regular insulin at 2100. Comparing that to my mouth. I'm going to clean my area. And we want to make sure we're changing sites so that we don't cause any scar tissue. And you also want to make sure that you keep it at least 2 inches away from the umbilicus. And we're going to pinch the skin. If I can pinch an inch, I'm going to go straight in. So we're going to go straight in. Inject our medication, our insulin. Done. And I'm going to dispose of my needle into the sharps container. And we checked with the pharmacy before to make sure that this medication was the correct route to be given, correct dose. And I was told that you wanted some information, so I brought some information about the medications that you received today. Also about a diabetic diet that can help you adhere to a better diet for you, keep your blood glucose in line, so there's that. And I also wanted to just mention that you should, I think I've already told you, you need to change sites. You should wear a medication bracelet in case of any kind of emergency. People will be able to help you. Signs of hypoglycemia would be cold and clammy, anxious. Your heartbeat would be beating fast. Are you on any beta blockers?
No.
No? Okay, good. Sometimes a beta blocker can mask the signs of hypoglycemia. Can you tell me some signs and symptoms of hypoglycemia?
Sweating, weakness.
Okay, so more so clammy, cold,
Oh, clammy cold.
anxious.
That's right.
Okay, and also a good idea might be to keep a candy bar or something sweet on you so that if your blood sugar does drop, you can eat something to try and bring your blood sugar back up. So, can you tell me a little bit about what I told you to look out for?
For the insulin?
For if your blood sugar drops?
Oh, yeah. I would feel like I need some kind of sugar weak, and so I would make sure I take my have something to.
Okay, so do you need anything else while I'm in here? No? Okay, you comfortable?
Yeah.
All right, you got your call bell here if you need anything, and we'll be back later to check your blood glucose to make sure the insulin's doing its job, okay?
All right.
All right. And I'm going to wash my hands as I leave the room. And I'm going to document everything that I did outside of the room. Megan, did you have any more questions?
I do. Were there any pertinent pieces of information that you reviewed before administering the medication?
I administered her allergies and her blood glucose level to make sure I'm not administering insulin to someone who has a low blood glucose level.
Okay. And did that information affect your decision to administer the medication?
It did. She was not allergic to the medication, and her blood glucose was 242, indicating that we needed to give her some insulin.
And did that information affect how you administered it?
No?
Okay. That's all I have.
Okay, thank you.
Thank you.